have the next question here. The question goes, my baby didn't cry right after birth and needed oxygen. The doctor mentioned HIE. What does this mean? And will my baby fully recover?
Okay. So HIE stands for Hypoxic Ischemic Encephalopathy, which means the baby has not, there was some problem that caused decreased oxygen supply, decreased blood supply, and obviously whatever we do in the NICU is we are concerned about neurodevelopmental outcomes. So something that is recognized right away, something like that, then we worry about long-term outcomes. So if they didn't cry right away, if they did not have, good circulation, or their oxygen levels are low, this is a very time-sensitive, medications or therapeutic interventions are going to be like effective only if things are recognized early. So this condition could have started right before birth. Like for example, baby's head is the cord, how the placenta and the baby are connected through what is called an umbilical cord. And if that is wrapped around the neck, or that cord is ruptured for whatever reason, or there is a placental abruption right before baby is born, or there is severe sepsis, like an infection. So baby shows signs of those, and that is why this prenatal monitoring right around delivery is extremely important. And there are something called fetal tracing that obstetricians are following, and they take their interventions like an emergency section or an emergent delivery, because this baby needs support right away. And in these scenarios, like if this is a concern for HIE, again there is levels of it. There is a mild, moderate, severe kinds, which we really worry about. But there is something called therapeutic hypothermia that can be provided to the babies if there is any suspicion for the second or third stage of it. But that's why it is very, so these are all like clinically identified, recognized, so to speak. There is a very clear criteria that we follow. And again, this is done in specialized centers that can provide what is called therapeutic hypothermia, or it is also referred to as whole body cooling. And we usually talk to families about what the expectation is, what the prognosis will be, what kind of support this baby may need. And it is not just that. Sometimes they may require ventilator management and infection management. They have obviously any therapy has its own side effects or complications, and we are monitoring them very closely to it. That consistent maintaining of the temperature is extremely important. So I'm hoping that they are in a center that they can be supported, or be moved to some place that can provide that support.
Thank you. Could you tell us a little bit more about therapeutic hypothermia? Like, what exactly is it?
So it is basically trying to stop the body into going into what is called like a destructive process. So whenever there is like a decreased oxygen, decreased blood flow, the body it's in danger, right? So then it goes into something like called like sort of like all blood cells are being consumed, all blood all the RBCs and the platelets, or so baby can go into like a severe shutdown. Okay, so what we're trying to do with this therapeutic hypothermia is pause that and support to the system take over for a good 3 days. Okay, so it's typically done for 72 hours, and then we rewarm baby within the following 6 hours. So it is basically maintaining them at a low temperature, so cooling, so their temperature is lower than the normal expected temperature.
Thank you so much, doctor.